Uncharted journeys, what lies ahead. To enable us to look at that in a little bit more detail, we maybe need to look at how genetics has been developing over the years. We have been offering genetic testing in the NHS since the late 60s, but in more recent times, with the sequencing of the whole human genome and development in technologies, we've been able to access the power of genetics in healthcare even more. Many of you may have heard of the 100,000 Genomes project, and this was a research project undertaken a few years ago where we recruited patients and for the very first time sequenced their whole genome. And this was for patients both with rare disease or with a diagnosis of cancer. The purpose of that project was to identify genetic variation that would inform their treatment and management. That project completed towards the end of 2017. And beyond that, we have adopted whole genome sequencing into routine NHS practice. And this has been a real game changer for us for the delivery of genomics to our patients. The impact of being able to offer whole genome sequencing to our patients is quite phenomenal. It has reduced the time to which we can provide them with a diagnosis, and that will help them make decisions about their family and what treatments they may wish to access. Moving on and moving to the future, we're starting now to look at how we can use additional information that is provided through that process of sequencing the genome to use in pharmacogenomics. So pharmacogenomics is a developing field of practice whereby we take the information of a patient's genetic makeup and apply that to what drugs we may prescribe for them. This is a very exciting advancement for the NHS and healthcare, and hopefully improves the experience that a patient has based on their genetics. For our cancer patients, we're using the power of genetics and genomics to understand the profile or the genetic makeup of their tumour sample. This can inform the correct treatment for the patient, but it can also open up access to research and clinical trials, accessing new drugs as they become available on the market. Research is an important component of genetics in the healthcare setting, and an example of that is the Generation project, which has recently been launched. In this project, we are offering screening of the whole genome for newborns, and this is providing early treatment options for those patients with rare conditions, which can really have a positive impact on their healthcare. By sequencing an individual's genome at birth, we are creating the potential to access a host of healthcare developments more rapidly across their lives. So going back to what lies ahead, the impact of genomics research really is becoming routine practice, and that is so exciting for us as healthcare professionals, but also for the patients that we serve.